talking about a cool Psycare project. Come on in.
I don't have sneakers, so let's see if this works well. Good afternoon, everyone. Mental health systems are under enormous pressure around the whole globe. Demand for care keeps rising, professionals keep scarce, and existing care models are struggling to keep up with this scale of need. Today, 1 in 4 people will experience a mental health challenge in their lifetime. Yet, despite this scale, access to timely support and continuous care is, for some people, remains limited. But the real challenge doesn't happen over sessions, over therapy sessions, because mental health journey is invisible for clinicians, because it happens in usually in structured sessions, shadow moments, limited in time, where patients share their experience and therapists try to understand what has been happening. But the real journey, the real mental health journey, happens during life, real life, where stress exists, in moments of stress, in moments of progress. And clinicians often only see fragments of this, relying on their memory and relying essentially what patients are able to recall during the follow-up consultations. That's the reality. And without continuous insights into the patient care's whole experience, mental health care becomes reactive. And interventions can happen later than they should because of this. At the same time, professionals spend a significant amount of time with administrative tasks, documenting sessions, and not focusing on what matters most, their patients. So the question is actually really simple but very powerful. What if clinicians could actually see the mental health journey of their patients as a whole, as it unfolds over time? My work sits exactly at the intersection between technology, AI, and mental health. I lead the first Portuguese research center on AI applied to mental health. I also lead Visual Thinking, a tech startup developing AI solutions, and Kashmi. I work with clinicians, mental health clinicians, for several years. And that is precisely why I choose to develop Psycare Studio, an AI platform to support psychologists and psychiatrists in their daily basis at their clinical practice. It's not an AI to replace therapists. Our approach is completely different. It's to amplify their capacity and enable them to focus on what really matters most. All of us, people. The goal is to move from isolated sessions to a new whole care model of continuous support that sees the patient all over the journey. By providing clinicians with structured insights, Psycare will help them better understand patterns and their progress and their engagement with the therapy, not just in isolated moments. The platform is grounded in strong scientific research and evidence-based clinical frameworks, developed together with experts in psychology, psychiatry, AI, ethics, and above all, compliance. At its core are our AI proprietary models trained specifically for mental health contexts that can effectively retrieve support to clinicians. From the beginning, Psycare has been developed with clinicians and healthcare institutes. We are running our first national pilot in a hospital at Figueira da Foz. And we have built this within multidisciplinary teams in order to truly support their work. Today we see extraordinary growth in AI. But a fundamental question still remains: who will truly benefit from this technological process? Real impact is not measured by algorithms or adoption curves. It is measured by real outcomes, better care, better support, earlier support. For us, the real impact of AI is simple: to bring support and care where it didn't exist before, including the fast-moving world of technology itself, because every mind deserves attention. And thank you so much for yours.